Great. We're at 11:33. We'll get started. Thank you all for being here today. We are going to be talking about rural health and the impacts of telehealth and in rural health, and some tips from our distinguished guests, Kathy Schwarting and Josh Braziel. From a housekeeping perspective, you can use the chat to ask questions. We will answer those at the end. We'll make sure that all of those questions are answered, and at the end of our presentation, which we try to allow for plenty of time to ask questions, and we probably may be able to give you a little time back in your day at the end, but all those questions will be answered. We do this webinar series every month, and today's webinar is the theme. We like to have a theme associated with our webinars. We think that helps to sort of cement that information. And today our theme is to sow, harvest, and reap the benefits of telehealth, and a close-up look of telehealth in rural areas. I'm honored today to have Kathy and Josh here with me. Josh is the CIO of the Rural Health Network of Oklahoma, which is a nonprofit consortium made up of 23 Oklahoma healthcare organizations. Josh has worked at 18 years of rural health public service leadership and 20 years in information technology and information systems. Josh has been involved in infrastructure planning and implementation projects across the country, ranging from the Department of Justice sponsored NCA track abused and exploited children's data system to multiple HRSA, FCC, and USDA telemedicine grants. In addition to his CIO duties at the Rural Health Network, he also serves on the board of directors for the Telemedicine Alliance for Oklahoma and Remote Area Medical of Oklahoma. Welcome, Josh. Thank you for being here.
And thank you for the kind introduction.
Absolutely. And Kathy Schwarting, one of my favorite South Carolina fellow South Carolinians, is the CEO of Palmetto Care Connections. She develops the statewide telemedicine and telehealth network called Palmetto Care Connections. She coordinates the telehealth and telemedicine activities across the state of South Carolina in an effort to create a statewide network. Kathy works every day to improve access to healthcare services in rural and underserved communities, and Palmetto Care Connection manages South Carolina's broadband consortium called the Palmetto State Providers Network. They also work to improve every day the broadband access across our state. As we know, in South Carolina, we are 90% rural, and broadband access is very difficult for the folks that live in our state. And Kathy has worked her whole career with a great team of professionals at Palmetto Care Connections, and they work with hospitals, health systems, federally qualified health centers, rural health clinics, private clinics, et cetera, and helping anyone to achieve better healthcare outcomes. Thank you for being here, Kathy. An honor to have you.
Thank you so much. And I reiterate what Josh said. Those were kind words, and I appreciate that. Thank you.
You are so welcome. You are so welcome. So moving on to our topic, some of the first things that happen when you're sort of planting in an agricultural area, which much of our rural areas are, is you have to sort of plant the seeds. You have to sow those seeds of success and put together a telemedicine program that can become and be sustainable for the organization and reach the patients that those organizations are trying to reach. So for Kathy and Josh, question for you: when we're sowing a rural health program in the rural health areas, where do you see the important topics and important tips for folks in rural areas?
Well, Josh, I'll start if you want me to. I think one of the most important things that you can do is you have to understand your community. And I know that folks say, well, they do needs assessments all the time. We'll just look at the needs assessment, but it's not just looking at the data. So you need to look at the data. And what we typically do is see what the greatest needs are and what services are out migrating from the area, because one of the things that we try to do in a rural area is to keep as much care local as we can. And if the providers in that community have capacity, make sure that we're utilizing them in any program that we have so that we can try to, bring some economic benefit to that rural community. But looking at the data, talking to your healthcare providers, you'd be amazed how many programs are started without actually communicating with those local healthcare providers. They have a wealth of knowledge. They understand their patients better than anybody. So making sure that they're included in the initial stages, and then later down the road, that will help you to ensure that they will buy into your program if they had some say-so in the early stages. Also, identifying some of your community stakeholders. There are lots of local champions in each community that I really think can help promote programs by word of mouth, through their churches, through their extracurricular activities. So making sure that you include the community in that. And then, of course, like Michelle mentioned, the broadband, if you're going to do a telehealth program, you need to make sure that the capability and the bandwidth is available for the type of service that you're going to offer. And you also need to understand your patients. I mean, do they have access to the internet? How are they going to go to a local community center? How are they going to be able to access that service? And so, Josh, I'll just kind of hand that over to you because I'm sure you have some information that you could share with us.
Yes, we could go really deep and spend the hour talking about broadband speeds and testing. But I think the first point you made about data, that's a real good starting point, and you need to be there. Sometimes in rural healthcare, we think, well, we don't have the data capability of the bigger systems or the urban areas, but we do have some, and we do have electronic health records, and we've got access to that patient data. But better yet, we've got experience in the community, and we have good ideas, anecdotal starting points to weed out some of the unnecessary. So, we may have an idea of what area we're going to start targeting with the data, whereas in a larger system, they would be processing much more to get down to the neighborhoods where they have patients and there's need and what the broadband is there. The broadband speeds, there's a lot more to that than advertised rates. So these internet service providers have a rate that they advertise. You never transfer data at an advertised speed. It varies wildly. Some do a very good job and get pretty close and are fairly reliable, but that broadband speeds is a lot more than a Google search. It's people out on the ground taking measurements and doing that over a period of time.
That's such a good point, Josh, that we see broadband being so variable regardless of where you are. Even you may have that advertised speed as you talked about, and I know we can talk forever about my own personal experience. How come I never get exactly what I'm paying for? But from an organizational perspective, these challenges that folks are having, what advice do you have? What's the threshold when you look at broadband access and what they absolutely have to have in order to be able to do a telehealth visit?
Well, generally speaking, if it's a new area to me, I'll look at the FCC data on broadband availability, and they've got a threshold of around 25 megabit download speed and 3 upload. You really need parity because the video coming from the patient out there in their home is just as important as the speed that the doctor's connecting. So they need to be able to upload very fast as well. So you start with that assessment, then you drill it down to particular areas. In Oklahoma, if we've got a project that's going to be a lot of remote patient monitoring or telemedicine visits in a particular area, we actually have technicians, including myself, we go out and test the actual speeds on the various services that are available. So we'll know what we're working with, and we can have that hurdle eliminated in the beginning.
Right, right. So there's a lot of pre-work that has to be done even to ensure that the connectivity, that basic piece is there. And Kathy, I wanted to ask you about something you mentioned in your comments about clinical expertise and reaching out and creating programs when you may not have even talked to the clinical areas that might be available to you. In some of the rural organizations that we've worked with, and these could be critical access hospitals or rural clinics, they're not able to draw the expertise to their area, and so they need to reach out and get that expertise excuse me, on an ad hoc basis as needed, or perhaps even ongoing. But many of these companies per se are not set up to have a smaller patient load to reach those patients that are in these more technically challenged areas. Do you have any tips for these folks in these rural areas for, getting the expertise that they need, finding the right people that they might need to talk to in order to have that expertise to improve access to their community?
So that's one of the things that Palmetto Care Connections does. We are really an advocate for the rural providers in those rural communities and in the underserved communities. And we are here, we received some money. Our state legislature a few years ago had the foresight to put some dollars into telehealth, into expanding it primarily for the rural areas and to creating a statewide open access network. So because we're a part of that, the services that we help a provider with, identifying what kind of technology you need for the service that you're providing. Again, making sure you have the broadband, identifying what your customers are going to need on their end. We can offer some of that assistance to any of the rural providers. And then the Medical University of South Carolina is also a HRSA designated center of excellence for telehealth. So they also have staff available to help the providers in these rural areas to put these programs together. So there's a lot of expertise out there. And I find that once you have a rural provider who has done a great job with implementing a successful telehealth program, and they've been able to engage their patients, I think it's really beneficial to have that provider's voice speaking to other providers. So we like to get testimonials. We like to create a lot of videos around certain rural programs. So other rural potential programs can learn from those peers or colleagues of theirs. And I think that's very beneficial when they communicate with each other.
Yeah, such a good point. Yeah, utilizing your own network. So when we think about, now we've taken the step of planting our seeds, we need to water it, we need to nurture those crops, we need to, grow these seedlings. And telehealth is much the same way. We have maybe a fledgling program where we're hoping that it continues to live, but we're not really sure what do we need to do to ensure that it's successful, that we do give it all the water and all the sun that it needs. So what are the ways that we can improve a rural telehealth program? How do we ensure that these programs are successful, because they are so critical in meeting the needs of the patients in those areas?
So I'll jump on this one, Josh, and then you can help me out at the end. But
Okay.
There are lots of ways you can create new programs, or you can use best case models that are already there to model your program after. Some of the things that we like to do is potentially expanding existing programs. So I'm going to give you a little story about, we have a federal grant through HRSA to try to create virtual access centers around the state in some areas that currently don't have primary care or don't have good access to primary care. So we've been working with some independent rural pharmacies. And for example, in Earhart, South Carolina, there is no primary care practice. And so that rural independent pharmacy is sort of like a center of a place where patients congregate already. They're already going into the pharmacy to receive their medications. That pharmacist already has a great relationship with the patients, but a lot of times the patients can't get from their home in Earhart to a provider's office. So we've tried to bring the pharmacist and the primary care providers together, and now we're offering telehealth in those local pharmacies. And it's a great way for them to know what the provider is prescribing and how they're treating the patient, so that the pharmacist can do some consultation on their medications to make sure they're taking the right meds. A lot of that kind of goes hand in hand. And then following the chronic disease programs that the pharmacists see every day. I think something like working in your existing communities, finding out what your providers need. And to be honest with you, it was the pharmacists that came to us looking for a better way to take care of the patients that she saw. Even though she only sees them for medication, she does a lot of community outreach. She does diabetic education. She has gotten certified as a CDE. So she's a really good community resource, but really responding to her needs and then matching her up with the local providers. And we've created what I think is a really unique program, and seen some patients that have not been to the provider's office in quite some time.
That's fantastic. That's a great example of utilizing another healthcare provider to be able to expand the access and be able to improve that. It's such an important, I'm sure this is a program that is mutually beneficial, as pharmacists appreciate the ability to be part of the care delivery of the patients that they're caring for. And then I imagine that the clinicians, those primary care docs, then now feel more comfortable even potentially talking to the pharmacist about other types of medication issues that they may not have done in the past.
And Michelle, one thing I'd like to add to what you're saying is, if you live in a rural community, you know, you're a little family, you know each other. Yeah. And our independent rural pharmacies, they're struggling. You know, they're having to compete with the Walgreens and the CVS's of the world. And so if you can really try to build programs around some of your existing businesses and providers and community leaders, it's just good for the community.
That's such a good point. Such a good point. Josh, do you have anything you wanted to add to that?
Yeah, I was going to parallel that HRSA project, the pharmacy project that you were just talking about, Kathy. We closed a HRSA development grant just in October of 2020, and it was similar, except it was delivering behavioral health into primary care. So the flexibility and the feedback that you were talking about with your stakeholders, your providers, that was a key in this different program as well. It was all about flexibility. Our last quarter was full Corona lockdown time, and the entire model of bringing a patient into that primary care setting, keeping them longer, and integrating their telemedicine behavioral health visit didn't fit the model of safety that the providers set out anymore. So, you know, we had to be ready and pivot and move that to home-based visits. So provider at home and patient at home.
Right. And, you know, Josh brings up a really good point, Michelle, with flexibility. So if you go to adopt or create a telehealth program in a rural community, and there is a best practice model for you to model your program after, you got to be flexible, because what works in a larger area doesn't always work in a smaller rural area. And you need to be willing and creative enough to modify the program to fit the needs of maybe your practice or your community, because not all of the programs, you can have two diabetic education telehealth programs, and they're both going to be a little bit different, because it needs to be adaptable to your patients in your practice, the way your providers want to work, and the way your community takes care of their local patients. So I would say, don't be afraid to change up a program, modify it a little bit. Josh talks about flexibility. There's a lot of federal dollars out there that allow you that flexibility to be able to say, you know what, we tried this, it didn't work. Let's change up, let's do it a different way. And that's part of the learning curve. And that's part of creating a successful program for your practice in your community.
Yep. Such a good point. I think that we found as well, depending on the organization, you might have very rural, but you might not have very poor, but you might have bad connections in one area, or you may have actually pretty good connections in one area. So it's all about flexibility and just trying to think, what's my goal? And then trying to reach that goal. You know, I'm trying to reach these patients in a chronic disease management scenario. Well, what's happening in New York City is not necessarily going to work in, you know, rural Oklahoma or rural South Carolina. So not to pick on New York City there, but very good points. So now we've got a fledgling, we've got a little plant. We're hoping that it will continue to grow. We still need to give it more life. We need to foster this program. We need to not only look at potentially grants, as we've talked about from a telemedicine perspective, and with the plants, we need to give it water, we need to give it sun. And so we need to ensure its success. And there are some practical pieces to think about when you're creating a telehealth program, especially in a rural health area. To your point, Kathy, the folks that live in rural areas are a family. They typically know each other. They know where they live, where they came from, when they lived in that house or moved. And so how do we take that practical advice and apply it to the rural communities? And Kathy, did you want to start, or is this a Josh start?
I can start. I think one of the things that you need to remember for a rural community is never underestimate how powerful word of mouth is in a rural area. I mean, if one patient has a great experience, they're going to go tell 10 other patients. You know, they're going to get on the phone that night and say, guess what? I had my first telehealth visit with Dr. McElhaney and it was great. And, you know, don't be afraid to try it. I can help you with, you know, understand the technology. So word of mouth is very powerful in rural communities. But when we create these programs, a lot of folks think you build it and they will come, and that's not the case. If you build it and don't tell people that you built it, they're not going to know to come, right? So you have to market and promote your programs. And that is going to depend, you know, that may change up depending on your community, your practice, and exactly what the program is. But getting flyers out there, social media is a great, very inexpensive way to promote programs. And a lot of folks in these rural communities are on Facebook. You know, a lot of professionals are on LinkedIn, but a lot of the consumers are on Facebook. And that's just a great place for them to get some good information. Take advantage of your local radio and newspapers. Some of these small newspapers, most people in the county get that same newspaper once a week. Write up your stories in there. Do it like we talked about earlier. Take a patient testimonial or a provider testimonial and promote that information. Put it on your website. Share your success stories. And the other great way that you can promote a program, other than the word of mouth and the literature and the flyers, is find your local champions. Find the people, like we talked about, that have had success with it, and let them help you promote your program, because their peers, the folks in the grocery store and at Hardee's, they're going to listen to the folks that they've known have lived in that same community for 20 years. They're going to trust their opinion on the quality of the service, the quality of the consult that they received. And so I think you just got to remember to market and promote your programs and make sure people understand that that program exists.
Such a good point. Josh, anything to add to that?
Yes, and I'm going to base this on my personal experience and past failures with programs. So I think it is very important that you put the word out there, but also that the program you build is exactly the program people want to use. Anyone who's been in telemedicine very long has rolled out a well-planned cart system into facilities where they were underutilized, and it's really frustrating. So, to link back to the planning, that's important in this piece too.
And
Also,
expensive.
this is sort of tangent, but for the social media piece, I've got a report on my desk. We're working with 2 universities in Oklahoma right now on COVID vaccination pods, and they're doing research on outreach and getting the word out. And counter to intuition, in the poorer rural communities, a higher percentage of the population cites Facebook as their sole source of news. So it's important to not only get the marketing out, but the basic facts, because, as we all know with social media, facts can sometimes be in the eye of the beholder.
Yep, such a good point. Make sure you're getting the facts from the right place and that you are advertising where people are getting their facts from so that you can get those facts out there. These are great points. Really important to communicate, to, tell folks to tell their friends and neighbors if they had a good experience. But one of the things that we've seen happen sometimes is the relationship between the doc and the patient is so powerful that if a doctor is not on board and they sort of say, yeah, you can use telehealth, so they'll communicate it, but then maybe have a hedge in their tone. You don't have to do that. This is an offering, but you don't have to, that kind of a thing. That can really have an impact on whether those patients will actually adopt telehealth or even take a chance on that in some scenarios. So what kind of things have you done? What practical advice do you all have for places where doctors aren't as on board and maybe, half-heartedly accepting telehealth, and which is affecting adoption?
So I think I will say that prior to COVID-19, our education efforts for Palmetto Care Connections were 99% focused on educating the provider. And I think the majority of, in my experience, the majority of providers who have a negative thought process about telehealth or a little hesitant that they can provide quality care that way, most of that can be taken care of with proper and good education. So a lot of it is an education issue. It is communicating effectively with the providers. And what I like to do is to do a lot of test cases. So if I have a provider that I have a feel just from his, attitude or the things he says that I don't think he's going to support it, I'll take time. I'll make sure that my staff goes over and does a demo with him. We'll let him do a pilot. We'll let him, do a test case and actually use the technology, because a lot of the education comes in the form of, once you've done a telehealth visit, there was a lot of information. I did looked at a study. This was a few months ago, but prior to COVID-19, about 76% of folks were a little weary about doing a telehealth visit. However, after they had done or participated in one telehealth visit, they were about 75% willing to try another telehealth visit. So it's really getting past that first visit. And I actually had a friend of mine who needed some mental health counseling, and I was trying to get him to do a telehealth visit. And he said, I don't know that I want to do this, because what if the people outside the door can hear me talking to the provider over the video? And I said, you know what? Even if you're not doing a video, even if you're just in the room talking one-on-one with your provider, there's that same chance that, they could hear that through the wall. It's no different
Exactly.
doing a video visit than it is talking to your provider one-on-one. And I think once they actually do that visit, once the provider actually tests it out and tries it with this patient and has a good experience, then they are actually sold on telehealth. So a lot of it to me is education and communication with the provider population.
Absolutely.
Yep. Sorry, Josh, did you have anything else to add to that? Did you have just in
Yeah.
agreement?
Yeah, I agree with everything said there. And that's a cart that I've been pushing for a long time. So all of the hurdles that are put up, I've done most of the things you can imagine over the years. So the story that you were just telling about overhearing, we have headphones to give people in case that will help. I've been to doctors' homes to make sure their network would run and show them a telemed demo visit from there to plant the seed that maybe I could get some of this work done from here versus driving in, because a lot of our docs make a 20 or 30-mile drive to their offices.
Right, right. I think also I would add that I found providing research and evidence of, and this goes to the education point, but it's specific to not just how a program works, but specific to resident research and evidence related to the success of a telemedicine program that's clinical research and evidence. Lots of these docs really want to operate off of evidence-based medicine, and I can't blame them. That's what we want them to do. So providing those studies, those examples from articles, from studies that you can find, and there's a variety of them that have been done now since COVID has happened. And I would also say try something easy. Don't spend a whole lot of time trying to bang your head against the wall with somebody, but rather look at, okay, you're not a fan, but let's look at follow-up visits. Can we do follow-up visits where you get an 80% no-show on, you know, some of these antibiotic follow-ups that you're doing where people are better and they're not going to come back in the office? So maybe you can get them to sway to come back in and do a telehealth visit. So really good practical advice from both of you.
I would tend to agree with you, Michelle. Having that evidence-based practice model is really important if a physician is looking for that. There's a lot of white papers out there now, you know, looking at the benefits of remote patient monitoring, diabetes education. So I applaud you for bringing that up because that's a really good point.
Yeah, thank you. So we've had our crops. We're ready to harvest them. We're ready to reap the benefits, the things that we can see tangibly that can happen with our programs. We've now fostered it in the way that we hoped, and we have a great crop. We have a great telemedicine program. So now that we're harvesting those benefits, what's your advice related to how to continue to be sustainable, how to continue to have that great harvest every year?
Well, if you're putting together a grant, and I think Josh and I would both tell you that we've worked with a lot of grants in our careers, and a grant is a great way to get a program started. However, in my earlier years, you know, I would find a grant and create a project around that grant. As I got a little wiser, I learned that that wasn't such a great idea, because you look for a grant, you start a program, and you have no plan for sustainability. However, if you already have plans or part of your strategic plan or part of your action plan for your organization is to, say, start a diabetes education program, then look for a grant for that program. And think about sustainability as you're thinking about the creation of the program. Don't wait. You know, if you have a 3-year federal grant, I used to think you didn't have to worry about sustainability until the beginning of the 3rd year of that grant. And again, as Josh and I get a little wiser over the years, you have to think about sustainability from the very beginning. I mean, if there's absolutely no way to sustain a program, do you really want to bring it about for a year knowing that it's going to end? So I think that planning is important from the very beginning. And now a lot of grants require, when you submit a grant application, you have to already have a sustainability plan in place. But another piece of sustainability is reimbursement. And I don't really have that on the slide anywhere, but looking at telehealth reimbursement before you create a program, make sure that as the provider, you can get reimbursed for that service, because, they're not, all providers can't afford just to give free service. I mean, they have bills to pay too, and it has to fit their business model. And so make sure that it's reimbursable. And I will tell you, in South Carolina, we are putting legislation together to hopefully go after some equitable, folks don't like to use the word parity legislation, but so we're going to call it equitable legislation, but making sure that post COVID-19, our rural providers who are affected the most can continue to get reimbursed for the telehealth services that they have created during COVID-19. Josh, you want to add anything to that?
Yeah, I've got a lot on that one if we have time for it.
We've got time.
Okay, so I think the key there, sustainability that Kathy brought up, it needs to go into initial planning and then every step of the process. So looking at those funding sources, each of those funders has different projects, different ideas, and different things that they want to fund. So if it's at the heart of your organization, or if the heart of what you want to do is deliver telemedicine, well, up until 2020 with COVID, there weren't a lot of telemedicine equipment and service grants floating around. If USDA, HRSA, and FCC will fund other projects that include what you're trying to do in telemedicine, that can be a big help. And you have to have an eye on all that all through the process. So I'm thinking of a specific rural hospital example. Generally in rural areas, especially hospitals and libraries and government entities, they don't have great bandwidth deals, and it's been a predatory system for many years. So if your facility wants to start a telemedicine program, doesn't have the budget for that, and you can do what we did in our case and form an FCC consortium to bid bandwidth, go through the USAC, RHC, and the state universal service funds as well. If you take their bandwidth costs, so if you save them $250,000 that year in bandwidth and telecommunication, that really helps their bottom line in a way that they can support a telemedicine project themselves. So while your work for the year may have been a bandwidth project, your end goal was telemedicine and better service for your rural citizens.
Such a good idea, where you can take, kind of take a different tact and find some grants and some opportunities there. And I know that from a financial perspective, we just had a hit on the rural health clinics. I think an inadvertent hit on them from a reimbursement perspective. So we'll see that and how that flows through the legislature, given the wording that's just come out to say that the fees might be a little bit lower. We do have a question that I think is relevant at this point, that they're asking about thoughts on using and patients in rural areas being receptive to the use of more asynchronous telehealth services when they don't have a brick and mortar close by, or they don't have bandwidth to support that telehealth. What are your thoughts on utilizing a more asynchronous approach?
So I'm okay with asynchronous, especially if it comes from the clinical perspective. I think you have to be really careful on reimbursements and what is allowable, because you're not going to be able to build the same codes for the same service with an asynchronous visit as you would with live real-time video.
I think Josh is right, and I think that goes down to the provider education, Michelle. The provider has got to understand what they can get reimbursed for. And some things are only, through a live video, and then, some could be through the virtual communication where it's almost like a texting back and forth. So really understanding your reimbursement around telehealth, I think will help with that a little bit.
And that's dangerous with the reimbursement and the time it takes. You're not going to have a happy provider if they assumed their rate for these services was X, and then when the billing finally goes through, they've done 1,000 of them and it's actually half of X.
Right. Hence back to the planning statement, that be part of the planning of a program and what you're really going to get paid on that program. Good point. So we've talked about lots of different areas of telehealth usage in rural healthcare, in rural care, and some tips for those in the rural areas to be able to be more successful and create this, field of agriculture, this field of telehealth, if you will, to be able to have a more successful program. And we need to know that the community now can reap the benefits of those seeds that we've sown, that we've nurtured, that we've, provided this care and feeding to, and trying to create a sustainable program. When you think about the things that the community benefits from and how they can see a real difference, what are some of your thoughts on that?
Well, one thing that we don't really have written in this slide is if you are and we have fought this for years and years and years, and if you're a rural provider on this webinar, you'll understand what I'm saying, but rural providers, they have to make sure that they are viable. And if they don't step up to the plate to offer telehealth to their patients are going to get that telehealth service from somebody else. And historically, since time began, we have larger systems that like to offer services in these rural communities. And what we try to do with PCC is to make sure that any large health system that wants to work in a certain rural community, that they work through that existing primary care provider and make sure that they are a part of that program. But if rural providers are going to, continue to treat their patients and not lose patients, they're going to have to offer some telehealth services for their patients, because if not, they are going to go somewhere else and get that service. So the benefit for the provider is, one, trying to hold on to your patients and expanding your patient capability by offering more services. I mean, consumers nowadays, once COVID-19 hit, we started getting a lot of calls from patients, and that was new to us. And they would say, why can I not get that through telehealth? I'm too scared to come into the doctor's office, and I need physical therapy, and I don't see where that is reimbursable, and my provider says they can't offer it. So consumers are going to start asking for telehealth services. And in order to stay competitive, I think our rural providers have got to step up to the plate and meet the needs of their patients. So that's one thing. But the advantages to the patient are just tremendous. Reduced travel time. Pandemic. I mean, we never had pandemic listed before, but older folks don't want to come into a doctor's office and sit in a waiting room where they're afraid that they're going to get sick with something that they didn't come in for. So, reduced travel time is great for the patient. It's convenient. The pharmacy story that we told you, trying to keep your local pharmacies viable and including them in a telehealth program is just good for the community. And then I'll give you an example. In the pharmacy that we're working with in Earhart, the pharmacist told me that she had a lady to come in and she had a horrendous case of shingles on her neck. Now, the patient had no plans to go in to see her provider because she didn't think that she could actually find transportation to get there. So she was coming into the pharmacist to actually see what the pharmacist recommended in a lotion or anything that she could give her. The pharmacist actually called the provider's office, got the patient set up within 30 minutes, and that patient actually saw her primary care provider for shingles and was given a prescription. So to me, that might be a small story to some people, but to me, that's a huge success and a benefit to patients in these rural communities. Just because you live in a rural community doesn't mean you can actually get to the doctor's office easily. So bringing the care to the patients, to the rural communities, I think is a great benefit for everybody in that community.
That's a great, powerful story. Powerful story. Josh, anything to add?
Yeah, I wanted to comment on that story because that's something that we try really hard to track. So that visit is, that's an extra provider visit. It probably wouldn't have happened at all if there weren't the telemedicine capability. So
You're exactly right, Josh.
yeah, even if the pharmacist says, I can't do anything for you other than this over the counter, you need to see your doctor, there's going to be a large percentage of the folks that walk out after that encounter and do not go see their doctor.
Yep, that's right. That's right. And I think that we can use these other areas that we see clinical services being provided as an opportunity for telehealth. You know, we're talking about pharmacies today, and there's several examples of that. But what about, PT offices where folks are going to get their PT done, or home care providers? Let's try to bring the care to those patients. To your point, in these rural areas, they either don't have the transportation to get there, or they're skeptical or unwilling. So bringing that care to them in all of these various ways is so important. And you mentioned, Kathy, that that's just one example, but that made a huge difference in someone's life, and they now aren't debilitated by the pain that they're feeling with shingles. So I call that a win for the day.
Me too, Michelle. And even, that you mentioned something earlier when you're starting your telehealth program, start with your small successes. Don't try to overachieve in the beginning. These small successes, they mean a lot to your patients, your providers, your community. So just because you only have a small success, maybe in the first month or so, capitalize on that, grow from that. Don't try to overachieve, because there's too much disappointment in life, I think, when we try to overachieve, and really look at some of the small benefits, because those are great stories, huge success stories to share to get more people engaged in your telemedicine program.
Yep. Very good point. Yep. That's why you guys are here. That's good advice. So we've had a bountiful harvest of advice, of assistance, of thoughts on how to best plan for your programs. I want to give you all a chance to comment on something that we didn't talk about, some final thoughts on how rural health and oral health care providers and those enabling them and supporting them can help to move telehealth forward even further. So any final thoughts?
I have a couple I would like to share. First, I see a number of folks on the call with a lot of time in telemedicine, and if any of you have ideas, suggestions, please chime in here, because we've got a heck of a group of attendees there.
That's true. You're right. We'll open up the microphone for others as well in a few minutes.
Okay.
So the only thing that I would say is sort of what Josh said. Speak up in your community. Be a champion for your community. Don't think that just because a program that you're trying to create doesn't exist, that doesn't mean that you shouldn't move forward with your thoughts. Because I think rural communities, we have to be creative. We have to think outside the box. We can't always follow the models that our metropolitan and state capitals follow. So don't be afraid to do something different. I mean, if it works for your practice and your community and your patients, then it's good.
That's right. That's right. We do have another question to the group before we allow some of our attendees that Josh mentioned. Some of them are experts in telehealth themselves, and others still learning. So we'd love to hear those folks and their advice as well. But have you ever used a community focus group, kind of representatives from the community to help decide on the design of a telehealth program?
Yes, absolutely.
Yes, I think that's a great idea.
And do you think those people, when you think about those efforts, when you create a community group, is that the kind of thing that you bring up to your points about communicating in the local newspaper and things like that? How do you start that kind of community focus group on a telemedicine program?
So
Well, you go ahead, Josh.
I was just going to say that in our case, we build it into each of the steps. So we want to make sure that we have community and not only healthcare providers serving on our board, working our events. It needs to be a component of all those community needs assessments that Kathy was talking about, not just studying university data, but local polling. And when you tie them in, you've built in some champions and some word of mouth folks out in the community with positive things to say. Because as you folks in rural areas know, if you don't give out the details, people will be happy to make them up for you.
Good point. What do you have to add, Kathy?
I would say that I am a big, firm believer in grassroots efforts, and all communities have their grassroots efforts. Everybody, if you've been in a community long enough, you know who to go to get a group together to run an idea by them. So I would say take advantage of those grassroots efforts, take advantage of the folks in the community that you know are powerful communicators. And that doesn't mean that they may be the best communicator in the world, but it means that they know how to communicate with the patients and the citizens in your community, and they are respected. And so if they support a program, a lot of the folks in the community are going to support it as well. So take advantage of those grassroots efforts in all of your communities.
Good point. Good point. Whether those are school principals or pastors or mayors of the town or county councilmen, or even sometimes HOA presidents, or just those folks that are, or even coaches that are those respected folks in the community in those rural areas. Well, we have passed on a ton of information today, and I know that there may be still some questions that are lingering, or folks that may see this webinar afterwards as it was recorded. So I wanted to share Josh's and Kathy's contact information. Mine is there as well if you have any questions, but please feel free to reach out to either of them. They will provide resources to you, answer any questions that they can, and try to help you and develop your program over the course of your term of doing these telemedicine programs. One thing I wanted to add before we finish, we did record this webinar, so it will be available on our website. Please follow us on Twitter, Facebook, and LinkedIn. We post quite a bit of information there. We also have a webinar next month on February 25th. It'll be the same time, same day, so Thursday, the 25th, 11:30 to 12:30. We will have Sherry Hess, the CNIO from Banner Health, as well as Rebecca Freeman, the CNIO from the University of Vermont. And we'll talk about informatics and how informatics is impacting the healthcare delivery model, and also we'll touch on some telehealth as well. So that'll be an exciting webinar in February. In addition, we've done a rural health radio show. Many of the rural health leadership in the country were part of a radio show that we did. The recording for that is on our website. Very good information there just to talk about the state of telehealth in rural health, in rural communities, and some valuable information there as well.
So Michelle, one quick thing, I think we made a boo-boo on the slide. So my email is ad.org. So if you want to reach out to me for a question, it's okay. It's palmettocareconnections.org.
Thank you for that correction. I appreciate that. PalmettoCareConnections.org. Thank you for that. We'll make the change on this slide and make sure that that's added onto there when we post this on the website. Kathy, Josh, thank you so much for spending some time with us today, making us smarter and sharing your knowledge with us. I'm honored to have you here today. Thank you so much.
Thank you so much for having us. And Josh, it was really great to get to connect with you again. I appreciate that.
Same here. Thank you, Kathy, and thank you for putting this together and having me, Michelle.
Absolutely, Josh. And thank you to everyone who joined today on the webinar. We do have, we've had some questions that have come up in the chat along the way. We've tried to answer those, but if you did have any other questions, let us know. We'll be happy to answer them. Thanks, guys. Appreciate it.
Thanks, Michelle. Have a great day.
You too.